Just know that it's just the group folks that it usually lingers with. It stays in the group space. Okay, so, and if you just came in the door, I think there was a few people that jumped in right after I'd already mentioned, but Chris is the normal host of this, Chris Wilkinson from Oyen, and he runs one of the transportation projects. And one of his drivers had to like step away, emergency, something today, just a few moments ago. So instead of canceling our session, I'm just facilitating today. So if you're wondering where Chris's face is, that is why. So, but yeah. Today we were thinking of just having a casual conversation on because it's Blue Monday and it's the new year here. And we know that's a difficult time for the older adults in our communities. I just have a few questions here that I wanted to lead our conversation in. But we just wanted to talk about like how you're fostering social connection and reducing isolation with your older adults right now. So maybe we can just go around the circle and you can introduce yourself and where you're tuning in from and what your program is about or what you're up to, maybe how you're reducing or fostering the social inclusion and isolation. Do you have any initiatives on right now that are increasing natural supports or building more connected communities and social snacking? And what do you think is important to foster a connected community for older adults? Like, what have you noticed in your work? And what do you think is important for that? So I put the little questions in the chat there since I listed a bunch of questions. But does anybody want to be brave and start off the conversation circle today?
I can start, but can you tell me where I get that? How do I get those questions again?
I just put them in the chat of this meeting here.
Okay.
If you open your little chat box, you should see them, except for the person that just joined. So let me just put them again because somebody popped in while we talking. Can everybody see them? Yeah.
Okay. I just wanted to introduce myself first. My name is Salam, and I am not only new to Medicine Hat, I'm also new to Alberta. I moved from Ontario, and I just stepped into this role mid-October. So my position is a temporary position funded by the government as the MAPS facilitation lead, which is modernizing Alberta Primary Care Network, system. And what I'm trying to do is find the community gaps in services when it comes to seniors' mental health. And I do have other things that I'm working on, but right now I'm focusing on seniors' mental health. So I'm looking at gaps in Medicine Hat, Oyen, Bezano, and Brooks, and Foremost. What I've seen by attending, a few of those meetings that Healthy Aging Alberta did fund Unison here, the Viner Center, to get us to hire 3 social prescribers, and that program is going to start on February. So what they're going to do is basically, the clinic refers a senior to the Viner Center, and the social prescriber can go around with the senior to try to get them to introduce them to activities, introduce them to other people, connect them, with other activities. So it's not just, accompanying them to doctor's appointments, but also go with the seniors and attend the activities with them, and then try to get them to make more friends with other people. And then when they feel like, oh, this person is, not shy and, they're feeling comfortable, they just, step back. But yeah, they basically support the senior for a whole year. So this is something that was, very exciting for us. And with Palliser PCN, we are going to have a staff meeting on early February, and this is something that we're going to introduce to all the nurses. So all our nurses that work in different clinics here know about it. This way they can, refer the seniors.
Nice. Thank you. And do you have any What do you think is important for a connected community for older adults? What do you think
I
helps
really
build?
think I think activities are very important to
Mm,
keep them connected. I can see, I actually, I used to work out we had what we called boomers at CrossFit. And boomers are seniors, 50 plus. And I joined their group because I was just, 6 or 7 months postpartum and I needed to exercise and my fitness level was really bad. What I learned there is that all the boomers had each other's contact. They actually hanged out and then they felt very, very connected. So I think activities are, recreation activities are very important. It keeps them connected and less isolated.
wonderful.
Thank
Thank
you.
you.
Yeah, I actually became friends with them and I would join their
Oh,
their
the
activities.
what matters
I
to
am
Hatters?
still
Yes.
considered one of the boomers.
Did you see the question in the chat of do you sit on the table of what matters to Hatters in Medicine Hat?
Let me see. What can you say that again, Stephanie, please?
What matters to Hatters? Yvonne's asking about what matters to Hatters in Medicine Hat. If you're on
Oh,
that
I heard
table.
about this, but I haven't seen it.
Yeah, hi, Solomon. It's Yvonne here. My counterpart, I guess I could introduce myself a little bit as well before I jump in, is hi, I'm Yvonne Rempel. I am a community health promotion facilitator with the Community Cancer Prevention Screening and Innovation Team. And one of our community initiative is the Alberta Healthy Communities Urban Initiative. And my counterpart in Medicine Hat, which is Molly Hansen-Nagel, is facilitating the Alberta, like what makes a community healthy. And she's been working alongside What Matters to Hatters this past year in pulling out a lot of the questions that you are asking, Salman, about what's the data. They've gone through 36 different assessments. They've collected all the data and now they're moving towards some action teams. So it'd be great if you connected to What Matters to Hatters. I can,
Thank you for that
if you
resource.
type in your email, I will connect you with my team in Medicine Hat. Yeah, I'm not sure who at the PCN, Medicine Hat PCN is connected to What Matters to Hatters and whatnot, but might be of valuable information. If not, I will connect you with Molly and or Cherie. Molly just happens to be sitting on a beach in Costa Rica right now for the next 6 weeks. So Cherie will be the contact person for Healthy Communities Urban Initiative. So
Amazing. Yeah, that would be very helpful. Thank you so much. I
you're
appreciate
welcome.
it.
Thank you.
I put my email down there, and
Perfect. Got it.
I'm not sure if anyone is connected, but yeah, if anyone is, they'll probably, bring that role up to me. Yeah, they'll bring it to me. So it's great if you introduce me. That would be great. Thank you.
Yvonne, you talked a little bit about yourself. Do you want to weigh in at all about what you think is important to foster a connected community for older adults in your area?
Yeah, it's highly important because I am of the age demographic. I'm born at the end of the boomers, so technically I class now as a senior, as if you class senior as 55 plus, which many do. And I work, my office here is in the Fairview Health Complex, which is the hospital. And I have a friend of ours who's in the hospital in acute care waiting for a long-term bed, and she's 93. And it really goes to show the importance of keeping our seniors connected. Um, you move from a seniors lodge where you have programming and you have the opportunity to be sociable, then you move into acute care and you have four walls and family and friends don't always visit. So I really noticed that isolation piece. And I'm just using that as an example. And she's not alone by any means. And often I look at that and I think, I don't want that to be me in 20 years potentially or whatever. So how can we work to do better? So I've been working alongside the seniors here in Fairview, Grimshaw, and in Hinds Creek, really focused on that social connection. And really often it happens organically. And it's just about being that local community connector and networker and
Mm,
bringing seniors and or others together as that important piece to stay connected.
mhm.
And if this also goes to the document is Canada's mental health report. If anybody's seen that for 2024, I can put the link in the chat, and it's a very good read. And you can click on which province you live in. You can see whatnot, but it is highly discouraging that lack of or social connection isn't as strong as we think it is. Even though we're all connected to one of these, doesn't necessarily mean we're socially connected.
Yeah, especially with the spread out of communities now that you're not. I was watching something the other day about how in the past, because we were closer, we had these multiple connection points as we're going about our day that force you into that contact with others. And we're not necessarily doing that as much anymore. So we're not getting those small little, I put the concept of social snacking in the chat there. We're not getting those little social snacks like we were. Um, thank you, Yvonne. Does anybody else want to chat? Answer, tell us about yourself. I'll put the questions in again if you, oops, sorry, I put them just to one person. Do it again. Anybody else want to tell us about yourself, your programs, what you have going on?
Sure, I will. My name is Shannon. I'm new actually into the FCSS role in Didsbury, coming from the FRN role. So in FRN was a provincial initiative as well, but they were dealing with, prenatal to 18 years old. So now FCSS primarily, I'm working with seniors and filling those gaps. So new as of the end of October. Certainly noticing that we do have an issue in terms of seniors not being necessarily connected. We have a group of really vibrant seniors who are connected. They come to everything. That's fantastic. But now it's trying to get in contact with and coax out those who are not coming to programs. Like has been mentioned previously, there are seniors who are not having visits from family, perhaps family's not in the area. They have children and lives themselves. Aging parents and whatnot don't have the support necessarily that they need, and they start to become quite reclusive. So trying to tap into that has been more difficult. What I have been doing is trying to touch base with the social workers in the area that are working with seniors, making sure that they know what programs are available, inviting a social worker to come with their clients to a program if they like. I think sometimes a gentle handoff is nice. Also, like Salim had mentioned, going to some of the seniors programs, perhaps that aren't FCSS initiatives, but just to show that genuine interest. I try and poll and ask seniors, what programs would you like to see, or what can we add? And of course, those who are already coming to programs are happy with things just as they are. So adding in new things can be a bit daunting. We have added in chair yoga. It's actually just video yoga that we have in a room, and the ladies and gentlemen are coming. We're having 12 to 14, which is fabulous, and they love it. We had some last week like, wow, I just met my neighbor, or I didn't know this person would be here. And so that's kind of neat, just to try really simple, low-cost initiatives to see if they'll get off the ground. Also,
you
I've
said
been
you're
looking
doing that video wise? Like, are you broadcasting a video or?
So I hold it here in our space, and we have a TV in the space. I pre-watch a chair yoga video off of YouTube, and we do it together just that way, just to prove that there was an interest before we bring in a live instructor. So yeah, that's been really interesting. Also working with our high school and talking to some of our seniors, things that they've noted is issues with household tasks, right? Eaves troughs that needs leaves out, or taking down Christmas lights, things like that. It would be really great, and something I'm working on is working with our leadership teams at the high school to partner with seniors to come and do some of those tasks. The youth would then be getting a letter of reference that they could use for post-secondary or job applications. In our area, there's not a lot of opportunities for jobs, so getting those letters of reference is really important. That's something I'm working on, as well as noting too, we have a lot of caretakers in our area that are the spouses of aging ill seniors themselves, right? So dealing with declining mental health, specifically those who have a loved one who has dementia and the relationship is becoming quite abusive. So trying to figure out, how do you navigate that? How do you get them to get home support when their loved one with dementia doesn't want anybody else but them? They don't want anybody in the home. And those caretakers become more and more isolated. We have started a monthly group where our caretakers are coming together just for an hour to debrief, talk about resources that they want, resources that they know are working, and to talk about what is it that we could do as a community to make life a little bit more comfortable. So like I say, I'm newer to the position, just trying to suss out what is it that we need. Of course, we have an ongoing transportation issue. Certainly you can solve that with volunteers, but I think, you know, wrangling in volunteers to drive has been a bit of a hiccup for us here. Continue to work on that, but it just is the reality. We don't have Uber. We only have one taxi who's not going to do within town trips. So it's tough. And when you look at FCSS funding, I truly believe that some of our leisure programs like chair yoga, like senior swim, etc., these are real mental health and physical health programs that have to be in place. They are preventative in nature. They feed into the physical health, mental health, emotional health, etc. We are not to be funding them through FCSS funds, right? So you have to be rather creative. And I think it's interesting, being that FCSS is preventative in nature, but these programs that we know connect and feed into wellness in all aspects, you're limited in regards to what you can fund. So it's interesting navigating this for sure.
Yeah, for sure. And in relation to the volunteers, sometimes it's hard to keep those transportation programs going. Of exactly, our host is dealing with that same situation today, right?
Yeah, it's rough. I know in some of the communities they've had a great response, specifically from gentlemen, and they were saying, you know, go talk to some guys. They like being able to help if it's something easy like driving. Take me from point A to point B, they can do that. Whereas, you know, not to be stereotypical, but generally the women volunteers want to be more connected emotionally, building relationships, etc. So trying to find retired gentlemen perhaps that love to drive and have them come on board. So yeah, continues to be a bit of a struggle, but I'm sure we'll get there.
Yeah, I think we've noticed that across the board, that transportation has been very much a dire need for folks. The transportation programs that we're funding have gone like wildfire right now and are above demand, or I guess over demand, or
Yeah,
out of capacity. So I think, yeah, like telling the story of this need, I think, so we could continue to, I guess, find support and investment in that area of the work, to me speaks as one of the areas that we would really help continue to foster that connected community.
absolutely. I think especially in our rural communities like us, you know, a lot of the specialists are in Calgary. That's 45 minutes away.
Yeah,
You know, that's just the reality of it.
yeah,
Sorry to interrupt. I wanted to say the same thing, especially in rural areas like Bazano, for example. There's no transportation, and people rely on seniors rely on volunteers there. But the volunteers, the volunteer organization works well within the city, local, but they don't have any way to get to Medicine Hat if they have medical appointments, or Calgary, etc.
yeah, yeah. And the few areas that do have some support for that are just overwhelmed right now. They're absolutely flooded with the amount of folks they could accommodate. Thank you. Does anybody else want to introduce themselves and chat about what they have going on? And
I'm happy to share with you. I'm Sharon Phillips. I'm a volunteer chair of Age Friendly Banff. And we put our action plan together a couple of years ago. And one exciting thing we're looking at right now is getting a men's shed started.
Oh,
Uh,
yeah.
yeah, there's a huge need for that in our community for sure. But it would look probably a little bit different from the initial intention of men's sheds, which were for retired men. But we thought one thing that we could do is do some intergenerational work.
Mm,
It's just now finding space. Of course, we've got people interested, but it's finding space. And as you can imagine, space in Banff, like many communities, is pretty limited, but we're very limited. The other thing that we started at the end of last year was a non-medical home support program, which was has been fantastic. It's the staff through FCSS goes into people's homes to do light housekeeping and whatnot. But as you can imagine, it ends up being very much more of a friendship, a
mhm.
support, companionship, and it really only got off the ground at the end of October, and we're already looking to hire a second person because the word has gotten out.
Mm,
Really helpful. The other challenge that we have in Banff is housing. And that would, what happens in our community is people either stay in their homes and they dig their heels in and say, I'm gonna stay here, come hell or high water. And they're isolated. They are no longer driving, they're on their own, they're not visiting their friends, they're not getting out. We have the same transportation issues as other rural communities do as well. But we're trying to get the town to consider those folks when it comes time to downsizing. Right now, people want to downsize. There's within sort of the core of the town where you would be able to walk to amenities. There's maybe 2 or 3 apartment buildings with elevators that are accessible, right, for people with mobility challenges. And we're just starting to in the throes, I guess, of discussing the design of a new building right
mm,
beside the hospital, which our group has advocated for in the past, saying, well, this would be an amazing building for people with mobility challenges. It's right beside the hospital. It's right next to all the amenities pretty much. And but because of course we have issues with staff housing, we've got a little bit of a battle with the town right now, trying to help them to see the need for maybe just doing an intergenerational housing
mm,
development so that we can include some of those seniors that are in inappropriate housing in terms of social isolation, and develop some maybe universally designed units that they could move into and age in place. And then when we get through this baby boomer phase, there's still great designed units that people can of all ages and abilities could live in. So those are our issues in Banff. Thanks for the opportunity to share.
Thank you for sharing. With the intergenerational housing, I think there's some good resources on CORE. We have a good intergenerational community practice group in there. And I think we have some good reports on and like other stuff on intergenerational housing and the benefits that you might be able to use to like, there might be some good stats there. I'm trying to remember what we have, but I feel like there's some, I
Yeah,
remember there being some good ones that might be able to help you push your position a bit more.
I am a member of that group, and it has been really helpful for resources.
Yeah, because there's some national stuff in there too, that because now that group is national. Um, with the men's shed space, have you chatted at all with the Banff Center up the hill? Because I feel with a creative group like that, if the men's shed is focused on creative things, you might be able to negotiate. They always have so much open space. You might be able to negotiate
We
something.
actually have been in discussion with them, and it always ends up being a liability thing because they do have
Mm,
a massive workshop there. We've also reached out to the Fairmont Banff Springs because they've got a massive carpentry shop there as well. And yeah, we're hopeful because it seems like a really good partnership for sure. But yeah, you're right. Banff Center was our first point of contact. You
Lovely.
could maybe write a letter. So
Like, hey. Do you have anything to say about like what do you think is important to foster a connected community in older adults?
well, I think just first off, space, availability to get connected. We do have a senior society that is their mandate is social connectedness, and they have a tea Monday, Wednesday, Friday afternoons. We also have um, exercise groups, swimming groups. So it's just, I guess it's advocating for this group of people. In Banff, I was an occupational therapist for 30 years in home care. So I have a very good understanding of what's lacking. But, people a lot of times just kind of throw up their hands and don't do anything about it. So it takes, I think, people at this meeting today to be advocating for those folks because sometimes I think they get discouraged or think they're forgotten or who really cares. But it's the energies of people like you that are going to make a difference.
Yeah.
And also Healthy Aging Alberta. My gosh, just the funding and support and the connections that we Age Friendly Banff have benefited from have been really, really helpful too.
And I know we'll probably have some more conversations around this. Well, of course, in the core group here monthly of what we're up to or what we can do. But I know we're going to probably have some focus on this for the summit too, on this social connection and isolation and social prescribing and all those different elements, age-friendly communities. Because yes, it's important. Thank you, Sharon. Anybody else want to chat? Talk about your stuff? What you have going on? What you're working on?
I guess I'll jump in.
Sure.
So I'm Tyler Savard, the Executive Director with Grand Prairie Area Council on Aging here in Grand Prairie, also known as Seniors Outreach. So I actually took on this role. Our previous Executive Director was with us for 30 some years and then retired in June. And then I took over the position in middle of July. So it's been action-packed, hit the ground running right from day one. Just in every which way possible. So we've been totally taking our even just our system of our process of how we're doing our work from being like in the Flintstone era of everything is a piece of paper to we're on the Jetson side of life where actually developing a database and getting things in order that way just so we can start pulling some stats accurately and see as to what we're doing. The other thing that I've introduced along the way. So we have the seniors outreach, of course, where we help with, all kind of government forms and making sure they're getting all the supports as far as whether it's financial or benefits or community supports or whatever that looks like happening through our seniors outreach programming. But then we also have our Meals on Wheels programming as well. So those are our two main ones. And then of course we do and then we do an additional break off of our seniors outreach is also our elder abuse awareness work. And then of course, then I just keep building upon everything. So amongst it all with all the different things that we already had in order before I started, and I've just been able to build upon things. We've had some changes with our team in that as well, just because, just life and retirement took place for some of them as well. And, just life is never dull, right? And so one of the things that I found like right away was that people like our seniors were coming in and they just wanted to be able to communicate with someone. They just wanted to be able to chat, right? So you get their whole life story, which is wonderful. And I found then also with our Meals on Wheels, we have a lot of people that are quite shut in. And so they weren't getting those connection points. So what I started is like, we have different, we've put up a big bulletin board in our office for when they're coming in. It shows ways that you can volunteer with us, ways that you can volunteer in the community, some different workshops and different places, you know, whether it's in person or online, and you know, just the different connection points. And we try to make sure that we have the accessibility to meet everyone where they're at. So if they're more of a pen and paper kind of person, or they can, you know, do some techie, we'll support them in making sure that that happens. So I set up like a workstation here in the office for our clients. So maybe they just want to learn how to do email, or they want to take in this webinar, whatever that is. Then, you know, we can support them in that. And then they don't have to feel so like, oh my God, like, what do I do? Or a lot of them don't even necessarily have, you know, the computer and such at home, right? And then, or if they want to learn how to use their cell phone, you know, like actually use it other than when it rings. So I just know I slide it, right? You know, because the smartphone can be quite intimidating, and I'm sure none of us use our phone to its full capacity. And then you get the next one that's like, oh my God, seriously, my phone can do that? And then it's like, how did you do that? And of course, there's always more than one way to do one thing on your phone too, right? So yeah, so what we've done is then just having those connection points and that communication going back and forth with our Meals on Wheels, where you know, we have a team of volunteers that are taking that hot meal. I've also incorporated some different information that's going to them as well. So like different ways that they can connect in community. You know, some of them, they are very different, very much isolated and homebound, but at the same time, then we're like, hey, you know what? Let's support you in the capacity of, if you're interested in doing one of these, just give us a call, and then we can figure out, you know, if it's like we have a volunteer or one of our staff will come over and then help get everything set up for you. So we'll do that kind of stuff, right? And also just the fact of, like, so we already do like with Meals on Wheels, like if it's their birthday or an anniversary, so we make sure we take them like a card signed by all of our team and a cupcake and that kind of stuff, like on their special day. And, you know, and it's amazing just the brightness that you bring to someone's, you know, to someone's day, or just, you know, to their little world. So doing little things like that, like, and they had that kind of stuff happening before, but I just sort of amped it up to what our team is doing and just making sure we are making those connection points. The other thing, I've also then freed up our outreach worker, and we're bringing on additional staff. But now our outreach worker, I've set it up so that, you know, we design our schedules so then they can go out into community to meet with someone who's not necessarily able to come into the office, you know, or meet with them and their caregivers and such. So doing that a lot more than just like before, it was just like just during tax time, go to the seniors lodges. And I'm like, well, that's just one point of contact. Like, we need to be able to have these relationships and get things going. And, you know, there's just so much more that they want to share with us. And also there's just more than one way that we can be, you know, supporting them. So we've, you know, amp that up and have that just, and then every time, so when we don't have to keep sending them back and forth. Okay, well, we did this today. Now we're able to get so much more done in that short period of time. And when we have them with us and they're like, okay, perfect, this is good. So it's like, hey, so now what do we do? Like, we've got stuff done. So which is really good. You know, we've amped up our, you know, our the holistic approach to, like, when, say, seniors coming in and are looking for housing, you know, for various reasons. And so then just making those warm handoffs and giving them all that information, walking them through how the process works. So don't call all 5 agencies that you know that are, you know, that are working with you for getting housing. There's one, start with them, and they are the one that they meet with everybody else. So everybody can, you know, basically bring their supply of what's available within their little cohorts of, you know, availability for housing. And then everybody has their demand list, you know, get on the main demand list. And then that way the partners can work together, because it's not going to do you any good to call everybody when they're going to direct you the same way. So we really walk them through that process. At the same time, if they're needing that help, we will also, you know, hey, you know what, let's sit down, let's call together, you know, so just, you know, because a lot of people are just really, they don't know the navigation process. And so it becomes very intimidating and very overwhelming. So we just give them that, you know what, we're just gonna, here, we can use my phone, put you on speakerphone. We have these little headset speaker box things, so it'll amplify so they can hear more of what's being said in the room as well, just so that they can be a part of conversation, not just sort of like, okay, so what was all that about? kind of
Mhm.
afterwards. And then the other part that we're in the process of just launching, and we're just calling it our senior social time. And so we've gotten a lot of stuff, like I said, like going from, the paper to being online. Now I have a bit more office space. And so we're getting furniture reorganized in that to have like a multi-purpose room in our office. And so that's when seniors can just come in, just sit and just visit with one another, just sit and have that coffee time. They can play some games. We're going to have some crafts. We're going to really empower them to make it their time. So if there's like a speaker that they would like to be brought in, we've already got a whole bunch of them like just on standby, really, just to be scheduled. But it's like, what do they want to do? So really just empowering them and then connecting them with one another as well, just on, hey, did you know about this? Or hey, and and it's amazing how even just the fact of like when they come in and they're having to wait for a few minutes for our outreach worker, and we're like, hey, would you like a coffee, tea, water? Oh, you know what? I got some other stuff too. I got hot chocolate, like, and then all of a sudden it's just like, all right, this is like really good. So it's been a very positive, and not to say it was negative beforehand. That's not at all what I mean. But it's just, we've just been able to take it to that next level and really just, just maximize on what we do have happening. So we got so many good things in place. We have a partnership with Veterans Gardens here in Grand Prairie, and they have a partnership which then they've been able to bring us in on. And so the one location of a Starbucks, when it comes time for like their times of where they have to clean up their shelves and these sandwiches are no good, and as far as their criteria, they have a volunteer that weekly goes and picks them up. They have a couple seniors that they support, that do a lot of volunteer work for them, so they support them with some sandwiches and such. And then they bring all these bags of everything else that to us, and then we put together care packages. Same thing if we find that like someone's sitting at the desk and they're eating a lot of candies, we're like, would you like a sandwich other than just a coffee? And so then we're able to put together those little care packages. And so we're also growing our Meals on Wheels program, which is open to all ages and stages of life, to also be a freezer program. So we're working with some community partners. One is with Grand Spirit Foundation, who organizes the functionality of all of our seniors lodging in this whole region. And then figuring out like, how can we work together? Maybe it's like you're making extra and then we can purchase it and we put it in freezer space, or like whatever that looks like, right? So we're in process of getting that launched as well this year. But again, every point of connection, whether it's with a community partner or one of our clients for any type of our programming, really trying to make sure we're sharing that information back and forth, and just to engage them as much as we can, and really that socialization, right? Just feeling like you're not alone. So, and then I'm also in conversation with I have a fellow Rotarian. He actually has a company that does it's all AI. And so I'm like, we need to talk some more and figure out, because people are just wanting to talk to someone. We've had a number of more so specifically elderly ladies that'll be like, I just really want to talk to someone. And so they call us, and it's like, thanks. I just can't take 2 hours out of my day though, unfortunately, right? I gotta spread my time for more people. But at the same time, you can talk to like this AI, and it's a person. Like, you don't know that you're actually talking to like basically a robot. It gives you the emotion, it gives you like it picks up on your social cues, as well as then gives you social cues back. And you can just have a whole conversation. And I'm like, that would be like really cool. I think I talk to my Alexa and I can get things done. I'm like, well, it's the same thing, right? Like just like I tell my children, use your manners. I don't care if you're talking just to Alexa, you still use your manners. You say please and thank you and stuff like that. And anyways, yeah, so just an idea of what we're looking into, and just to increase that communication and that opportunity to engage and not feel so alone.
So many ideas there. Thank you for sharing. Lots of really inspiring ideas. You almost need the old idea of like pen pals, you almost need the phone pals or whatever, where they can talk to each other instead of the folks on your team.
Yeah, we've actually thought about that too, and how we can do it, how they can without like what the permissions on how we can share their
Yeah,
information versus like but I was like, oh, you know what, AI, I don't need that permission. I just need
yeah,
the
AI, you don't
permission
need the
too, right?
same.
So yeah, so lots of different ways of, as my grandpa would always say, there's more than one way to skin a cat. And I'm like, why are we skinning cats? But
Why are we getting cats? Yeah, the Alex Community Food Center in Calgary here has a peer advocacy program that does a bit of that folks, so it's not necessarily anybody and their uncle that can chat with folks, but they have trained volunteers that are just there to be the soundboard for folks that want to come in and just kind of unload and just have a chat or whatever, right? Yeah, that sounds really nice. Well, thank you for sharing. Does anybody else want to share? I feel like we have time for like one or two more sharings before we.
Hi, everyone.
Hi.
Hi, yeah. My name is Kemi, Kemi Anjariwu. I'm a community outreach caseworker at the Unison Elder Abuse Shelter here in Calgary. And I actually signed up for this workshop just to get more insight on how to support seniors dealing with mental health concerns or challenges. In response to the question in the chat box, basically what we've been doing is to design different programs to, get get the seniors engaged. Programs like art workshop, fun things, and also learnings. But over the years, we thought about, you know what, why don't we spice things up? Let's get their feedback. So based on the survey feedback that we got, they want to see more programs around mental health support, around anxiety, around, panic attacks. We're talking of seniors that are fleeing from abuse and they now, secure housing and they've been in a safe place and now they have to be back in the community. So the most common question or concern that they had was, programs around mental health, support, mental health initiatives. So that's why I'm here today, just to, get feedback and get ideas on what you have going on in your own agency that is working for you. And yeah, so that's it.
Thank you. Thank you for joining us this time. And we do have, if there's lots of ideas that we're sharing right now that are really lovely. And then we also have some of the past, I don't know if you caught when I said the past recordings from this group of just like our circle discussions. There have been some months we've done even more of a mental health focus, or like last time we did an addictions focus. So those are just in the group space. They're there if you wanted to go back and peek at them and see what we've chatted about previous times. And as far as like the elder abuse one, we actually have a specific elder abuse group. So we had a lot of content that came out they had some presenters in November and also in May. So we have some really great presentations in the elder abuse group playlist there as well, if you wanted like specific things around that. But thank you for sharing. Any one last share before we wrap things up for the lunch hour? Or you could share maybe some things that have been successful that you've done, or maybe some of the areas, what elements maybe do we still need to build in our communities to foster this connection?
You'd mentioned earlier, or we had talked about, I think the number one barrier to social connection is that transportation piece.
Yeah.
It is huge, or again, it's part of that, you don't know what you know until you know, right?
Yeah.
And seniors, depending on age, and mobility, I guess, access, age, and whatnot, is how do we get to those seniors that aren't in the system? Word of mouth is still our best means of communication, I guess. And how we can work within our own communities to kind of build that, there is that phone a seniors phoning seniors program many communities have adopted, which I think is awesome. or that visitation program? How do we do a better job of utilizing the assets in our community already versus why reinvent the wheel?
Yeah. Yeah, great ideas.
And again, where do you, in each of our communities, where does someone go, maybe a family member or the seniors themselves, to access that information?
Yeah.
Because it is a generation that isn't necessarily online. Some of them are, absolutely, but to make that information convenient.
Yeah.
Almost we need to go back to that printed resource guide, almost like, you know, our little phone books.
Yeah, and like some of the bigger cities have the printed resource guides as well. An interesting idea for connection that a friend of mine did during the early parts of the pandemic, is they went back to the idea of a town crier. And so they were involved in a community association here, working at a community association. So they'd go around, and instead of just the printed newsletter, he'd go around and he'd yell out the updates and the upcoming things. Um, out of well, during the summer months, it was on a bike, and I think in the winter months, it was pulling the car up and then hollering down the street. But it was the same time every week, so that folks that were stuck actually knew what was going on and the communications. And so sometimes it's even just thinking out of the box of like, is one of our volunteers willing to do some interesting things and some creative things? Anybody else want to comment on the
Hello, everyone. My
Hi,
name is
Lola.
Lola Faribi. Sorry, my video is not working. So you might not be able to see my face, if that's okay. I just want to talk a little bit about what we do at Unison. Unison and at Kirby Center, we have a connection center called Wellness Connection Center. And I was just trying to look at the main thing that we do, which is making sure that seniors are able to connect to each other. And we can be able to mitigate those that isolation and loneliness. So we have a program called Live Well, Be Well, where it's on Mondays. And that's the greatest one that I think fosters connection between seniors. So they come in the morning for meditation. Then after meditation, they go right into Live Well, Be Well, which is a program that just talks about different topics that affect them. So like today, we talked about dating. You know, do you still want to date? It doesn't matter, that you can still have those relationships. We talk about things like self-love, how you can love yourself. You know, we talk about grief. You know, we've talked about different topics. And the most amazing thing is that it comes from them. So they give us those topics. They let us know what is affecting their mental health or affecting their lives. And they give us those. And then we develop the topics, and then we present it to them every Monday. And then coming into that meditation calms everybody down. And then we go into Live Well, Be Well. It's just a good one that brings people in. No matter how cold it is, we have up to 20 people gather, talking, connecting, and they also connect outside the programs. So it helps them to just find new friends, find people they can connect with, they don't feel lonely. So that's the major one that we do on Mondays, and it's been very successful. So I just wanted to share that.
Thank you.
Yeah,
That's wonderful.
and
Thank you
sorry
for sharing.
about the camera.
Oh, no worries. My internet's been spotty all week for whatever reason. So I actually Yvonne's my backup right now in case it boots me. Because yeah, sometimes it just doesn't want to do things. Well, thank you everyone for coming today, and for those of you who shared. It's really inspiring to hear what you have going on, and I think it can help the rest of us be inspired by that as well, to even of like what opportunities could be happening in the areas we are and what we can build out. like I mentioned before, we are running these monthly. Chris has been setting some themes for each one for this casual circle. I'll put in the chat here our little survey if you wanted to give some, or you could email us too if you have thoughts on future topics or themes, or even right now we've been running them as a coffee circle, but if you want, if there's special presenters that you're really interested in seeing too, we could also look at those for the year as we're planning out the year. And just thank you again, everybody who shared. If any of you are interested, some of the other things I'm running this week, tomorrow we're talking, especially around that conversation about intergenerational work. Tomorrow we're talking specifically around intergenerational work in dementia with intergenerational group. And that's on the core event calendar. And then Wednesday morning, we have a presenter talking about de-prescribing and how older adults can navigate their medicine, and if they're having too much medicine for certain things, and how they could have more of that circle conversation with their medical professionals to navigate that. And then in the afternoon, we're actually talking, as we're talking about social connection, we have our systems map presentation. So that Healthy Aging Alberta launched our systems map last fall. So if you want to know a little bit more about it, what's going on, how it works, how you can play around with it and use it to also build your own connections like this within locally or provincially, Lauren and I will be chatting on Wednesday. We'll have a session there, and we will record it if you can't join us. All of these are going to be recorded. If you can't join us, I'll put them up on Core after. So if you feel like coming to any of those other ones this week, you can either send me a message if you can't find it, but they're all in the Core event calendar. You'll find the links there for the Zooms that I've put up. But yeah.
Hi, Stephanie, just a quick question. So I just wanted to know, you were talking about some recorded messages. Where do we get that from? Because I just came in when you were talking about that.
So we have two places. I'm just going to pull some links here. Okay, so first of all,
thank you.
I'm putting the event calendar in the chat here. So usually that has a list of all the events that we're doing with the other groups, or maybe some non-group related stuff like the systems map. So that's the stuff that's going on. Usually after an event, there's a few things that happen. I will link the video. I'll post the video on YouTube if we've recorded it. I'll link the video to the event calendar post, so you can usually go to the event calendar and just pop open the video from there if you can't find it otherwise. And I'll also make a post if it's attached to a group, I'll make a post in the group. So you'll see if you're part of that group, you'll just get a notification of like, Stephanie's put up a new post about blah, blah, blah video, right? So it'll, unless you turn your notifications off, it'll tell you. And often I will also send out an email saying the video is live, so that folks get that message that if they did turn their notifications off, they get that. The other place, if you're just trying to look for an easy way to find them all from past ones, let me just pull. Here are all of our, where are you folks? Now I'm lost here. There we go. Here's our YouTube channel. So we have 19 groups in Core, plus I run presentations that are outside of groups. So in there, each one has a playlist on our YouTube channel. So if there's a certain theme you're looking at, like intergenerational work, elder abuse, food security, what are some of our other groups? Emergency prep. There used to be some of the previous social connection, wellness, mental health. They all have playlists in there. So you can kind of go through and see if something that we ran maybe even a year ago is helpful for your work. Some of them have presenters, some of them are conversation circles. It's a mix, but usually it tells in the description what happened in that session. So
yeah, that's very helpful. Thank you.
Well, thank you, everyone. Have hopefully a not so blue Monday and not so cold and dark blue Monday. And thank you all for coming today, and we'll see you